Hello, my name is Katherine Gallagher, and I am a psychology and dance double major here at HPU. I will be presenting my advanced research methods in psychology capstone project, which was mentored by Dr. Danzis. This project investigates the role of body investment in the relationship between sexual trauma and suicidality. A quick disclaimer before we get into it, my research and presentation contain sensitive topics, and my methods will describe some of the experiences asked about in my measures, which can be a bit descriptive. Sexual violence is defined as a sexual act that is committed or attempted by another person without freely given consent of the victim or against someone who is unable to consent or refuse. Sexual violence includes both contact experiences and non-contact experiences, and is often perpetrated through violence or physical force, threat and intimidation, coercion, or substance use. Sexual violence is highly prevalent, with 1/3 of women and 1/4 of men reporting experiencing physical sexual violence in their lifetime, and about 21.3% of women reporting having experienced a completed or attempted rape in their life. Sexual violence is a major public health concern, especially considering its association with mental health consequences like anxiety, depression, post-traumatic stress disorder, and suicidal thoughts and behaviors. Research consistently finds a robust positive relationship between sexual trauma and suicidality across genders. And given that suicide is a leading cause of death globally, resulting in more than 800,000 deaths each year, there's an urgent need to identify the mechanisms linking sexual trauma to suicidality. This is especially important to study in young adults, where rates of both sexual assault and suicidal ideation are elevated. One construct that may help to explain this relationship is body investment, which refers to an individual's engagement with and care for their body, and this can include facets such as body attitudes, body image, comfort with touch, and behaviors related to body protection and self-care. Body investment is theorized to be compromised by psychological trauma, which can alter body perceptions and experiences, potentially facilitating self-harming or suicidal behavior. Emerging research has found evidence that body investment may be a protective factor against suicidality. A study conducted by Brausch and colleagues in 2021 found that acquired capability for suicide was significantly associated with suicide attempts when facets of body investment were low, but not when they were high. These studies have also called for future research to examine the kind of experiences responsible for bodily dissociation, specifically the role of trauma and adverse life events. Though no studies to date have directly examined the relationship between body investment and sexual trauma, some existing research suggests that sexual trauma can significantly alter one's perceptions and emotional experiences of the body. A few studies have specifically explored the link between body image and sexual trauma. Sexual trauma has been linked to body image dissatisfaction, negative body attitudes, and body dissociation. In one study by Borgman et al. In 2014, sexual violence survivors displayed significantly stronger negative emotions and cognitions and higher dissociative reactions when viewing their bodies in a mirror compared to healthy controls. These results suggest that sexual trauma can lead to aversive emotional responses to one's body, possibly contributing to negative psychological outcomes like suicidality. These emerging findings emphasize the need for additional research on body investment in sexual trauma survivors to determine how this may impact psychological health. While prior research has established strong relationships between sexual trauma and suicidality, and separately between low body investment and suicidality, the interaction between sexual trauma, body investment, and suicidality remains unexplored. The goal of the current study is to investigate how body investment is related to experiences of sexual trauma and suicidality among young adults. I hypothesized that body investment would mediate the relationship between sexual trauma and suicidality. This study was approved by HPU's IRB, and participants were recruited via the institution's Introduction to Psychology participant pool and through solicitation for volunteers. The survey received 131 responses, but due to missing responses from some participants, 128 were included in the final data analysis. Of those 128 young adults, they were primarily female, Caucasian, heterosexual, and their ages ranged from 18 to 24 years old, with a mean age of 19 years. My materials consisted of all self-report measures of each of my variables. There were 51 total questions across all three measures that participants responded to via a Qualtrics survey. Sexual trauma was measured by the Sexual Experiences Survey, specifically the long-form victimization version. And this version consists of 21 questions measuring unwanted sexual experiences and the frequency of these distressing sexual experiences. And for the purposes of the current study, a history of sexual trauma was scored as a dichotomous variable in which participants who responded yes to one or more items on the survey were considered survivors of sexual violence, whereas those who responded no were included in the non-survivor group. I also inquired about the frequency of each type of unwanted sexual act by asking, did any of these experiences happen to you one or more times? And participants reported the frequency in a text box next to each experience. Body investment was measured by the Body Investment Scale, which consists of 24 items measuring one's experience, feelings, and attitudes of his or her body. Scores were measured on a 5-point Likert scale from I do not agree at all to I strongly agree. Finally, suicidality was measured by the Suicidal Behaviors Questionnaire, which consists of 4 questions measuring suicidal ideation and attempts, and it was scored on a 6-point Likert scale. Participants signed an informed consent form and completed the 15-minute questionnaire via Qualtrics software, and participants completed demographic information and then the variable measures. After completing the questionnaire, participants were debriefed on the goals of the study, and they were thanked for their participation. We analyzed our data by testing a mediation model via bootstrapping using Model 4 of the process, macro, and SPSS. We entered sexual trauma as the predictor, body investment as the mediator, and suicidality as the outcome. I also ran a partial correlation between sexual trauma and suicidality in order to remove any variability due to body investment. So we found that body investment partially mediated the link between sexual violence frequency and suicidality. The direct effect of sexual violence frequency on body investment was significant, and the direct effect of body investment on suicidality was significant. The indirect effect of sexual violence frequency on suicidality through body investment was significant, as was the direct effect of sexual violence frequency on suicidality. These results demonstrate partial mediation. Essentially, body investment explains part of the relationship between sexual violence frequency and suicidality, but there is still a relationship between the variables when ignoring levels of body investment. And we can see that through running our partial correlation when we removed variability due to body investment, as we found that the correlation between sexual violence frequency and suicidality decreased from 0.388 to 0.267. Essentially, my results indicate that more frequent experiences of sexual violence were associated with lower levels of body investment, suggesting that survivors may become emotionally detached from their bodies. Additionally, lower body investment predicted higher suicidality, indicating that detachment from one's body may increase the risk for suicidal thoughts and behaviors. Body investment partially mediated the link between sexual violence and suicidality. The indirect effect was significant, and the direct relationship remained, though reduced when controlling for body investment variability. Essentially, body investment explains part but not all of the association between sexual violence and suicidality, and this suggests that additional mechanisms likely contribute to this relationship as well, such as shame, lack of social support, or PTSD symptoms. Clinically, my findings suggest that interventions targeting body investment, such as yoga, dance, art, or other somatic therapies, may reduce suicidality among sexual trauma survivors. The efficacy of such interventions should also be studied longitudinally to track whether changes in body investment over time predict changes in suicidality among clinical samples. Universities and clinical settings might also consider assessing body investment in suicide risk evaluations and include body-based treatment plans to better support sexual violence survivors. Limitations of the study include the use of a convenient sample of predominantly female, heterosexual, and Caucasian young adults. It is necessary to explore how these findings may differ in older adults, as well as more diverse populations, as sexual violence impacts men and sexual and gender minorities as well. An additional limitation of this study was that it focused on the frequency of sexual experiences rather than the severity or type of sexual violence. Future studies should examine how body investment and suicidality are impacted when experiences are more severe, and how non-contact and contact sexual violence affects embodiment and suicidality. Future research should aim to identify which facets of body investment, such as self-care, comfort with touch, or body protection, are most protective against suicidality. It's possible that promoting particularly important facets like positive body attitudes and self-compassion may foster resilience in trauma survivors. Longitudinal and experimental designs are needed to clarify causality, as it is possible that suicidality itself may lead to lower body investment. Future directions of this research could also explore additional mediators or moderators between sexual violence and suicidality, such as gender, social support, or cultural attitudes towards the body. Continued research on body investment should examine how this mediation pattern may hold for other forms of trauma, including combat, natural disaster, grief, or racial and community violence. Please scan this QR code to see my references. I look forward to answering any questions at HighPerks. Thank you for listening. This slide is here as a breakdown of some of my data analysis further in case audience members have questions. Thank you.